Okay, this is going to be a demo of the ALS chest pain scenario. Before we get started, a couple things to point out. You can see a due date here, so you could make this an assignment and how many attempts learners have at it. A couple things down in the settings here. We can flip over from virtual reality to mixed reality, some different language options, and then some accessibility settings as well. So once we're ready, we'll go ahead and load this up. And here we'll be presented with a pre-briefing screen. So kind of setting the scene, any information you want the learners to have before they start. You can see here we have a 78-year-old male. Somebody called in 911 saying that the patient is alert but in significant distress, chest pain, difficulty breathing. Learning objectives: interpret a 12 lead, implement a treatment strategy, also communicate critical findings, and then summarize the conditions, treatments, current status. A couple things also is this can be completely customized. So you could change this to be, a local street in your area. We can change the avatar, the environment, any of the learning objectives can completely be edited. So we'll go ahead and hit start.
Medic 3, you are on scene with a 78-year-old male with chest pain and difficulty breathing. 911 caller states that the patient is alert, but in significant distress.
Remember that dialogue with anyone other than the patient is to be initiated within the dialogue menu under the Assess tab.
So before we get started, just how I'm going to communicate to this guy. I press and I hold A. It'll process. He'll give me a response. As you can see up here, this is how I'm going to work through assessing him, getting him on a monitor, and treating him. So we'll go ahead and start our conversation. Hi, sir. I'm your medic. Can you tell me what's going on?
I have this crushing chest pain, and it's getting hard to breathe.
And how long has that been going on for?
It started about 2 hours ago and has been getting worse.
Have you taken anything for it yet?
No, I haven't taken anything.
Is it radiating at all, your pain?
Yes, it's radiating down my left arm.
And on a scale of 1 to 10, how bad is your pain right now?
It's a 10 out of 10.
Okay, can you go ahead and lay back for me? We're going to get you hooked up on a monitor and take a look at what's going on.
All right, I'll lay back.
So I'm going to go ahead and get some PPE on, just acknowledging what kind of PPE for this patient. Some patient info, height, weight, if we need to calculate up any drugs. Resources is where you could put your local protocol. Here is a national guidelines for chest pain, so we can reference this as we work through this guy. Let's go ahead and get him on a monitor so I can remove his upper clothes and then get him on some vitals. We'll go ahead and order that 12 lead now and see what that looks like. That can be placed out, interpreted as needed. Okay. Let's get him on a couple other readings.
Assessment
here.
of Stan's neurologic status can be documented in a menu labeled Baseline Neuroassessments at the bottom of the Assess tab. Also, a sample protocol pertaining to Stan's chief complaint can be found in the Resources menu under the Assess tab when you are ready to provide treatment. Feel free to use it as a reference.
And that's what I just pulled out. So again, that can be changed to your local protocols. It's just an image that can be swapped to anything you want the learner to be able to reference. So now we're looking at some vitals here. Sir, are you having any trouble breathing right now?
Yes, it's getting hard to breathe.
Okay, let's get him on a nasal cannula. And we'll see if that helps. If it does, that SpO2 will go up over time. And per our protocol here, we can give some aspirin as well as some nitro. All right, so I'm going to go ahead and give you some medication. We're going to give you some aspirin to start, okay?
Thank you for giving me the medication.
So we'll go ahead with those. And then let's go ahead and give him some nitro. All right, this is going to go under your tongue. Just let it dissolve, okay?
Okay, I'll let it dissolve.
Okay, so we got some nitro going. We got some aspirin going. Let's do a little more assessment here. Let's check his pulses. Okay. And you can kind of work through his body there as needed. For other assessments, if we want to listen to some lung sounds, we can pull out our stethoscope. He will come up and help us here. Okay. I could walk around posterior if I want to listen to posterior lung sounds. Can also check pupils if that was important. I can pull out a pen light. We can get some other vitals here for him. So that all looks all right. We can see the SpO2s went up a little bit. So are you breathing any better now?
No, it's still hard to breathe.
Okay. So we can go ahead and change that. Let's go ahead and get him on a non-rebreather. And we'll see if that has a little bit better of an impact. So let's do this neuro assessment. These are kind of in-scenario quizzes. So level of responsiveness. And I'd say he's alert. Level of orientation. Sir, do you know where we are right now, what time it is, kind of what's going on, why we were called?
Yes, we're at my home. It's morning and you were called because of my chest pain and trouble breathing.
Okay. So we'll go ahead and say he's oriented here. So once we're comfortable with kind of our initial assessment, we got him on a monitor, we got our 12 lead out, we're working through our protocol, we can go ahead and transport him.
For purposes of time management in this simulation, 5 minutes have passed since your last nitroglycerin dose.
And those narrations will come in to kind of help speed up time, so we'll go ahead and give him another nitro. All right, sir, I'm going to give you another dose of that medicine, just again, same thing, under your tongue.
Thank you for giving me another dose.
All right, so we got that. All right, we're going to go ahead and get you loaded up in the back of the ambulance, okay? We're going to take you to a hospital, get you some more help.
All right, I understand.
Okay. So now we'll transport over to the ambulance.
3. Now that you are in the back of the ambulance, advise me of your transport decision. Go to the menu labeled Transport Decision under the Treat tab. You will need to make both a destination and mode of transport decision.
Let's go ahead and get this back out. Let's get our 12 lead back out. And now that was asking me another in-game quiz. So transport decision, based on his current condition, where's the most appropriate place to take him? This can be edited again to be your actual name of the local hospitals, the freestanding ERs. We're going to take this guy to the university-based hospital with the cath lab. And then transport mode on him. We can go non-emergent or emergent. We'll go non-emergent.
Thank you for the update, Medic 3. Contact Med Control on Med Channel 2 when you are able. This is located in the Assess tab under Dialogue.
Okay, so that's referencing in here, Med Control. So any communication outside of the patient is done through this Dialogue tab. So now I'm speaking to Med Control.
Loud and clear, Medic 3. Go ahead with your traffic.
So I'm telling them I'm en route to the facility with a 78-year-old male. Chief complaint of chest pain, difficulty breathing.
Thank you, Medic 3. I will alert the cath lab. Prepare for a direct admit there. What did your 12 lead EKG show?
So another in-game quiz here. We'll go with this anterior septal wall STEMI.
Understood, Medic 3. How are the patient's vital signs?
So
For
vital
purposes of
signs.
time management in this simulation, 5 minutes have passed since your last nitroglycerin dose.
And you can see his blood pressure's been coming down as well over time. Sir, how's your pain now out of 1 to 10?
It's a 6 out of 10 now.
All right, so it's getting better. Current vital is mildly hypoxic, but that was resolved with oxygen. You can see that non-rebreather has been working. and he is hypertensive.
Understood. Treat with nitroglycerin and morphine per protocol.
Nitro.
We will see you in the cardiac cath lab upon your arrival. Med control clear.
Okay. So, all right, sir, I just gave you another nitro. We'll see if that helps a little bit more, okay?
Okay, thank you.
So from here, we got the call in to med control. We're bringing him into the hospital. We've got him hooked up to vitals. We've started our protocols. Really, the only thing else I can do at this point would be to give him some morphine, so we can calculate that up if we want. But really, this completes the scenario. So we'll hear a narrator pop in here in a second, kind of summarizing what we did. And then it'll bring me to the debriefing log so I can see what I did well, things I could improve, also an evaluation of all of my soft skills.
Arrival at the hospital. Good work, Medic 3.
You've completed the simulation. Next, you'll receive your score and can review areas where you may be able to improve. Thank you for training with VRpatients.
So from here, we'll be presented with the grading. So evaluation on the left is covering all of my soft skills. That's AI generated. You can change what the standards are. So you can craft the responses within the evaluation here. This again is telling me what I did well, where I could have done better. Did I show empathy? Did I collect enough history? And then grading is if you want to tie points to specific interventions, that can be done. So I can go through here, see if I, correctly did nitro, if I put them on oxygen in time, if I put PPE on, that can all be referenced. And then the beauty of virtual simulation, I just did it. I debriefed myself, I hit replay, and I can run this scenario again and again and again until I feel very comfortable in a chest pain situation. So that concludes the chest pain ALS scenario.